Hello, I'm Dr. Brawley Wong. My pronouns are she, her. I'm a board-certified family physician, and today I'm coming to you from Ohio as I visit my family. Let's talk about the timeline of expected changes with hormonal affirmation today. So, got our time turner. Let's go talk about timelines. First, let's start with a busy but comprehensive chart of the overall timeline. Then we will deep dive into each aspect of change. So masculinizing changes are shown here at the top, and feminizing changes are represented here on the bottom diagram. The lighter, brighter color represents the range at which these changes start, and the darker lines represent the timeline in which we see maximal changes occurring. Something you'll notice is that the masculinizing changes have a little bit more color to them than the feminizing line. This is because testosterone also affects the monthly bleed and it affects voice changes. Additionally, you might notice that masculinizing changes tend to start a little bit earlier and take longer to reach maximal effect, 3 versus 5 years. The first deep dive slide will be into some initial changes. These initial changes usually involve the genitals, which leaves picture options for YouTube limited. The blandness of this slide represents the journey well. There will not be big, flashy changes in the first few months. For masculinizing therapy, one of the earliest and most exciting changes is that menses stops or the monthly bleed stops. This usually occurs around the 2 to 6 month range. On a side note, leave in the comments below your preferred term for period or menstruation. Back to the slides. At the 3 to 6 month mark, people will start to notice enlargement of the clitoris, and that maximizes around the 1 to 2 year time frame. Any clitoral growth is permanent. Additionally, people will notice vaginal atrophy or dryness of the front hole. If this becomes bothersome, your doctor can prescribe topical estrogen cream that will relieve symptoms without interfering with the rest of your masculinizing affirmation. Feminizing therapy has a less thrilling start than masculinizing therapy. A common initial change seen at the 1 to 3 month mark is decreased libido. The maximal timeline for decreased libido is about the 3 to 6 month mark. This coincides with the start of decreased testicular mass, also known as the decrease in size of tissue that produces testosterone. For some, this is seen as an encouraging side effect, a signal that the change is starting. For others, though, this can be an alarming side effect, especially if decreased libido is not expected. There's nothing inherently dangerous about decreased libido, but if it's negatively impacting your relationships, you can speak with your doctor about adjusting your dose of medication or even speaking with a gender-affirming therapist. Estrogen and spironolactone have variable effects on erectile tissue function. If you desire to maintain function of erectile tissue, speak to your doctor about starting a medication like sildenafil, commonly known as Viagra. This will maintain erectile tissue function without affecting the rest of your feminization. Next, let's talk about skin, muscle, and fat changes. As noted previously, masculinizing changes tend to appear earlier than feminizing. So around that 1 to 3 month mark, whereas feminizing starts around that 3 to 6 month mark. In the first 1 to 6 months of testosterone therapy, you'll notice your skin becoming more oily and having more acne, like seen in this photo, which maximizes around the 1 to 2 year mark. Also in that 1 to 6 month mark, you'll start to notice fat redistribution that maximizes at 1 to 5 years. Masculine fat redistribution, I'm circling on this diagram here, is seen in yellow. It's traditionally called an apple shape, or less eloquently, a beer belly. Increased muscle mass occurs a little later at the 6-month to 1 year mark and maximizes over the 2 to 5 year mark. For feminizing therapy, things really start to kick up in the 3 to 6 month range. There's a variety of changes, including skin changes, fat redistribution, decreased muscle, and, drumroll, breast growth. So the decrease in muscle mass usually maximizes early at the 1 to 2 year mark, whereas these other changes maximize around year 2 and year 3. Skin changes wise, the skin will become softer and usually more smooth. As for fat redistribution, typically is more of a pear-shaped, since the fat deposits tend to go to the hips. Now, we need more studies on breast growth, but from the very limited data we have, most patients can expect to gain 1 to 3 centimeters in breast growth or be in the A cup size range. This, however, can vary greatly. The latest changes are changes in pattern of hair growth. For masculinizing therapy, masculine pattern hair growth and hair loss tends to initiate around the 6-month to 1 year mark and maximizes over the next 1 to 5 years. Masculine pattern of baldness or hair loss tends to mirror that of other men in the family. Usually it starts with receding hairline in the front, then some thinning in the back, and progresses on from there. Additionally, with testosterone, you'll get voice deepening that usually initiates around the 6-month to 1 year mark and maximizes between year 1 and year 2 of therapy. For feminizing therapy, hair growth will start to decrease around the 6-month to 1 year mark, and you'll reach maximal effect over the first 1 to 3 years. With estrogen and spironolactone, hair that's already present will never fully disappear or go away. It will simply become thinner and lighter in color. Essentially, the hair is changing from a terminal shape, dark, thick, like I'm circling here, to a more vellus pattern, which is lighter and thinner than I'm circling here. If you desire complete hair removal, you'll still need to wax or shave or do regular laser hair treatments. The only form of permanent hair removal is called electrolysis, which differs from laser hair removal. So, what questions do you still have about the timeline of expected change with hormonal therapy? What other reproductive health topics do you want to learn about? Leave your questions and wisdom in the comments below. Since today's video was a little extra long and I'm traveling, I am going to take next week off. Thank you so much for watching. If you enjoyed, please like and subscribe. I'll see you next time. Zola!